Namaste and Siddhi Pranam. Welcome to your today's topic, how different stages of pregnancy can affect the yoga practices. And let's begin with understanding the different stages of pregnancy. So as prenatal teachers, we must have thorough understandings of the different pregnancy stages to really guide the mothers through their different yogic practices during different times in their pregnancy. So during the 40 weeks of pregnancy, the mother's body goes through significant changes, and also the baby also develops and grows. And there are different stages that comes during the pregnancy. So understanding these changes that occurs during each trimesters can really help you be effective at the practice for mothers, and also guide them safely through all the practices during all the trimesters. So the first trimester is basically the time for rapid growth and development for the baby and the mother's body as well. And the body is adjusting and accommodating to so many different changes in the first trimester itself. So there are many symptoms such as fatigue, bloating, breast tenderness, frequent urination, morning sickness are very common during the first trimester. There are medical tests which begins to happen in the first trimester itself, such as blood tests, urine tests, ultrasounds, and different other tests are performed to monitor the health of both mother and the baby. So we need to modify the practices in accordance to all the different kind of changes that the mother's body and her also external environment is going through, whether it's the pressure of newly introduced all kind of tests she has to go through, new things that she needs to take care of, and the way she's looking at her body all over again. Now she's being sensitive at so many things. So really considering all those factors while including all different practices into her yoga regime. So prenatal yoga can actually also really help her, the mother, to be a gentle and a supportive practice, and really help her focus on the positive sides of the pregnancy and create a space in the body to accommodate the baby well, and really allow to relax into all the changes that are coming into her body and mind and in her environment as well. So we need to begin with avoiding any kind of inversions or deep twists in the beginning itself. So even though the mother has been a regular practitioner of yoga, still she might feel that her body is just the same, she looks the same, but it's actually not the same. And hence it's very important to remind the importance of not overdoing any kind of asanas, and also deep twists and inversions are absolutely no in the first trimester itself, as they can actually put unnecessary amount of pressure on the abdomen, which we really want to avoid at this stage or during all the stages of pregnancy. So you can really help the mothers to manage symptoms and cope up with any kind of physical or emotional changes that the pregnancy is bringing to her, through really introducing all those gentle practices in the beginning itself that she might require. So understanding all the symptoms that she was going through in the first trimester will really help you design that. And as the mother progresses through second and third trimester, her body continues to change, and hence the practices needs to adapt and accommodate all the changes that are occurring in her body and in her environment. So it's really crucial that as yoga teachers, we really stay up to date with the latest information that is coming up. And time to time, there can be latest scientific research on prenatal yoga as well that is coming up. Or so whatever resources that you can get hands-on to during your journey as a prenatal yoga teacher, I really recommend for you to continue to educate yourselves, and really continue to educate yourself about the different stages and different conditions of a pregnant woman in each stage or each trimester of her journey. And by doing So you'll be able to really provide the mother with safe and effective prenatal yoga practice, and that will really support her during her journey and really give her a very transformative time during the prenatal phase of her life. So next is, let's start and begin with first trimester, all kind of medical tests she has to go through, the bodily changes and the precautions that we have to take care, and the yoga practices that we need to modify in accordance to the conditions of the body in the first trimester. So we begin with understanding that the first trimester of the pregnancy is actually a very critical time for both the baby and the mother. As the baby begins to form and grow, it's important that the mother has to take really special care of themselves. It also includes like she is staying active, even though it's a crucial stage and the baby is just developing. And we'll discuss about if there is a history of any kind of previous miscarriages, then what to take care or not. But if she has this as a first pregnancy, then all she should focus on is really staying active. Even though this is first trimester, she can stay active. If she have had a medical history of miscarriages, or doctors have for some reason asked her not to be too active, then there's something else. It's just a special case scenario. Otherwise, it is really recommended for her to stay active, eat a well-balanced diet, and also specifically engage in activities that will promote sense of relaxation and well-being in her. And during this time, the mother should also be really mindful of potential risk to the pregnancy or any risk that can lead to any miscarriages. So there is, in all the pregnancy, usually there is 15 to 20% known and unknown chances of miscarriages. So only 80% of the pregnancies actually survive the first trimester. So you should know that there is always a risk involved of losing the baby for known and unknown reasons in the body. So prenatal yoga can actually be a great way for the mother to really take care of themselves during this first trimester. And it's all about becoming conscious that a new being has entered their body, and really changing the approach in the mind from being an independent woman and having her own body to herself, so such that she can eat anyway, move anyway, act anyway, but now transforming to that very careful motherhood, entering into that careful being where you know that you're responsible for someone else. A new being is coming to your womb, and you owe every food that you eat, the way you move, the way you treat your internal and external environment, how you keep your mental health in check. All this matters now very, very much, because it's not just about herself anymore, it's about the mother. So prenatal becomes a very, very good way to make her conscious and aware of this first step into the motherhood. So since prenatal in itself is designed to promote relaxation and well-being, so this can really help her dive into her journey of beginning the self-care, not just for herself, but the baby also. And it can also help her let go of too much fatigue or symptoms like bloating that she goes through in the beginning of the first trimester. And the mothers can also use prenatal yoga to really begin to prepare their bodies physically, and also really understand and be aware of all kind of emotional demands and mental demands that it's going to put on their mental and physical health to birth the child. Also, at the same time, prenatal will actually introduce many practices such that mother can start making a very strong bond with the baby. So it's really important that mothers are really able to use a healthy approach to take maximum benefit out of their practice and really use all the knowledge and information that you share with them. So coming on to the different kind of tests that occurs during the first trimester. So most tests that occurs in the first trimester are non-invasive and do not really require any special precautions while practicing yoga. But at the same time, it's important to keep an eye on the symptoms that mother has or any kind of different bodily changes that might disrupt her practice or routine in any kind. So all that is required, even though the tests are not that major that will any way disrupt her physical or mental well-being. So there are going to be blood tests and urine tests and also swab tests for any sexually transmitted diseases. We just need to take care of that women who is actually 35 years old plus or older might require to undergo more testing, and her risk of miscarriage is way more than the women who are under 35 years of age. So the blood test that happens during the first trimester is called blood type screening for Rh compatibility, is the first and foremost test which is done during the first trimester. And this test is actually done to determine the blood type of the mother and the baby and to check if there are any incompatibilities between them. The other blood test is done, it's called rubella, and it's also, there is one test for checking any anemia in mother. There is hepatitis B and C, syphilis, test for HIV, glucose levels, cystic fibrosis, career testings, and TRI 21, 18, and 13. All these tests basically help her detect any kind of underlying health issues and infections that could affect the pregnancy and the health of the mother and the baby. And then there are urine tests which are done to check the protein and the sugar levels in the body. And these tests help detect any potential health issues such as gestational diabetes or risk of preeclampsia, etc. The next is swab tests. So swab tests are basically done for sexually transmitted infections, which can be really, really harmful to mother and the baby. So early detection of STIs or sexually transmitted infections can really help prevent any adverse health outcomes. The next and the most important stage is the ultrasound, and ultrasound is really done to detect the signs of trisomy 21 and 18. So it actually is checking the viability of pregnancy and the number of fetuses or the number of babies in the womb. And this test really helps monitor the growth of and the development of the fetus or the baby, and also detect any potential health issues in advance. One of the tests is also called cryonoric wireless sampling, CVS, which is invasive test, and it's done between 10 to 13 weeks of the pregnancy. This test involves the collection of placental cells to detect chromosomal and genetic disorders such as Down syndrome or cystic fibrosis. And although this test is crucial in detecting any health issues, it also carries small risk of miscarriage, with 1 in 100 women miscarrying after this test. So it is essential that women goes through CVS, refrain from any prenatal yoga or any other physical activities at least for 72 hours or until cleared by their doctor. So I myself personally went through this CVS, and it's actually really a choice given to the mother if they would like to know if there are potential risks for child to be autistic in future or having any risk of Down syndrome. And it's important that mother knows that there is a slight risk of miscarriage, and I'm sure the doctors really explain this before offering a test to the mothers. But you as a teacher should know if the mother is opting for this test, then any yogic activities or strenuous physical activities are to be restricted at least 3 days after the test. So this is an important point to keep a note for. The next is the kind of symptoms that the mother goes through. So first that we are going to discuss is fatigue. So fatigue is a very common complaint during pregnancy, and it can be caused by various factors such as hormonal changes, increase in weight, and body's need to produce more blood. And this fatigue can actually be reduced by engaging in very slight physical activities, and prenatal yoga is one of them, to really help improve overall mental and physical well-being of the mothers. The next symptom is nausea or morning sickness. It's a very common symptom in pregnancy, and varying in intensity from queasy feeling to vomiting also. And this is often caused by increased hormones. And again, prenatal yoga can really be helpful in promoting relaxation and reducing the stress that is being put upon the body due to the increase of hormones. In some cases, mother can actually go to extreme sort of nausea, wherein she can vomit so much that she can dehydrate to a riskful level. So she needs to be admitted at the hospital. But that is a rare case scenario which does happen with some women. In that case, of course, you would know that, and of course, the physical activities would be required to be stopped for a few weeks at least until she is back into her energy to go back to practicing any kind of physical work or yoga. Next is bloating, and being bloated is another very common feeling during pregnancy, and it's also caused by increase of progesterones and slowing down of peristalsis in the body. And prenatal yoga really can help elevate bloating by improving digestion and promoting relaxation and reducing the discomfort. So during the asana series, we have introduced many asanas that can be practiced gently, such as Muktasana, but partially with one leg. That has been introduced in the asana series to really help the mother elevate these symptoms. Next is breast tenderness and increased size, which along with it can happen with pronounced nipples also at the same time. And they are also very common symptoms during the first trimester. And with help of certain asanas, we can help the mother to improve blood circulation and reduce any discomfort in the breast area, and really promote sense of relaxation and reduce stress that happens in the breast area also. So all the chest opening asanas or stretching of the upper body can really help her reduce the tenderness that is happening in the breast. The next thing that can happen is also very common is frequent urination, and it's caused by higher level of HCG, the hormone in the blood, and which actually irritates the bladder. So that really pushes the mother to go often and urinate. The yoga that we practice can really help improve the bladder control, and it can really help reducing the discomfort at the same time. The next very often the thing that happens is craving for certain food and also sometimes loss of appetite. And it's also very common symptoms that begin in the first trimester itself. And when we practice asanas that help us regulate the digestive system, and also if the mother is eating a very balanced diet, that can also reduce sort of discomfort with any kind of cravings for certain foods or kind of loss of appetite at times. So if there is a loss of appetite, doctors usually recommend the mother to eat in very, very small portions, because it's important for her to eat. But if she's not feeling like to eat because of too much nausea or something, then she's still recommended to eat often, but in small bits and pieces, such that she is able to maintain some energy in the body as well. Next is constipation, another common symptoms during first trimester, caused by increased level of progesterone in the body. And again, this is one more symptom which can be managed with yoga, especially with asanas that help with reduction of working on the digestive system, or all the asanas that promote regular bowel movements. There are many of them. We'll discuss in the asana series later. Well, menstrual cessation is another symptoms, and wherein slight spotting can actually occur for the mother. And if there is any way, this is not too common, but is common during the first trimester, that she can really experience light spotting of blood through her vagina at this stage. But if there is heavy bleeding or pain, then of course this is a much serious issue than slight spotting. So doctors do recommend immediately going to the emergency care and getting the opinion urgently from the doctors. And most common reasons for slight spotting is usually stress that is happening in the body. And of course here prenatal yoga can play a very crucial role, especially practices like yoga nidra, etc., which can help reduce stress on the body and the mind, and induce relaxation for her to really be settled into herself and let go of a lot of things that are bothering her, and that can reduce such symptoms at the same time. Shortness of breath is the next symptoms. Very, very common, and it continues till the third trimester. And this happens usually because the uterus is expanding and putting a lot of pressure on the diaphragm. So this is the reason that breathing is a very, very important part of prenatal yoga, and regular practice of pranayama can really help reduce all the discomfort that happens during the prenatal stage, as the diaphragm is under very, very much pressure, and just not the diaphragm but all other organs are squeezing, like the intestine, kidneys are being squeezed by the uterus and putting a lot of pressure on other organs as well. So the more mother is able to breathe slowly and expandedly, that will really help her to go through this phase more powerfully, and also release some of the stress that is being put upon different organs. Next is increased sensitivity to the smells, which can often cause more nausea or vomiting. And these symptoms can also be reduced with help of certain practices in yoga. Now, we have to make sure that we are never overstretching during the yoga practice, because in the first trimester itself, the hormone relaxins begins to release in the mother's body, and overstepping at any point in time can really be harmful, because because of the release of relaxing hormone, she would not be aware of the fact that she's overstretching the body. So just reminding her is a great practice to put in place, that she should not at any point in time is overstretching her body. Relaxing hormone can also cause instability in the joints and the connective tissues. So being aware of this is very, very important, and allowing the mothers to know this also is very important, such that they are aware of what their body is going through and can help themselves to really not overstretch at any point in time. Also, as a yoga teacher, you should remember to introduce only gentle stretching in all kind of asana practices, and promote stability and comfort before anything else while practicing all the asanas. Next is Ujjayi breathing, and so pregnant women should actually be able to maintain normal Ujjayi breathing without getting out of breath. So this breathing technique can really help them regulate the breath and reduce the stress. So if you introduce Ujjayi breathing quite early in their pregnancy journey, it can really, really be helpful for them while the body goes through the changes and the organ gets squeezed more and more and the breathing gets difficult. So if they know this practice, they can go through the pregnancy very easily, and also at the time of delivery, it is a very good practice. Now, heart rate. Heart rate is, so ACOG has removed the 140 heart rate limit on their recommendation, allowing pregnant women to exercise at any heart rate as long as they can carry on a conversation while doing so. So ACOG is like a kind of American agency to recommend guidelines for the mothers. But having said so, whatever may be the scientific guidelines, it's important that as long as mother can easily talk while carrying on any physical activity, that means that physical activity is suitable for her and she's able to comfortably do it. So we may not have monitors all the time to check her heart rate, even she has certain devices on her body, but still it's difficult to keep a check all the time. But this is a good pointer to know that if she can comfortably have a conversation while doing that particular exercise, that means that we are good to go. Important another point is dehydration, and it can cause contractions early or in any stage of pregnancy. So being hydrated and is very, very important for pregnant women. And so having enough water before and after the yoga practice is a very crucial practice in itself. They can also keep their water bottles aside by their side and drink whenever they feel like. So it's important that you as a teacher keep that check and really keep them guiding on not to dehydrate at any point in time, and always carrying water by their side. Also, maintaining a core body temperature is very crucial for a pregnant woman in the first trimester or during all trimesters basically. So the core body temperature should be below 101 Fahrenheit or 38.3 degrees Celsius to avoid any overheating. So if she starts to feel too cold or too hot at any point in time, it's important to stop the practice. More likely she is going to feel too hot, and sometimes she can feel certain sweat on her forehead, and just because of overheating of the body. So all these should be covered in the guidelines for the mothers, that if they start to feel that they're feeling overheated, they should stop the practice for a while, calm down, and then begin again if they feel comfortable. Avoiding any discomfort, once again, becomes a very crucial point at this stage. So sometimes even it can feel that this asana is very simple, why should we even take precautions? But doesn't matter how simple it looks, if it's causing discomfort, in any manner, it should be avoided. Being mindful in the moment, in movements. So every pose should be entered into very slowly, and keeping in mind and that any discomfort or any rush should not be there at all. So the focus should be one and one only, is the safety of the baby. So it's important that entering into asana and exiting from the asana is very mindful, and any injury should be avoided at all point in time. So that should be your primary focus. And the mothers should also know that's how important it is to not to rush over, to not to put any kind of jerks on their body while getting up, going down, or entering into asana or coming out of it at any point in time. Now, certain asana practices should be avoided for the 3 days after the test, which we have discussed before also at the point of CVS test. Next is starting slow. It's important to start the practice slowly and allowing the mothers to, only do part of the class and rest in child pose often whenever required. So in the first class, the students actually should only do 80% and see how their body is actually responding. And slowly and steadily, they can increase their number of asanas or practice if required. And you can also introduce that, let's say, in a 1 hour session, you begin with mantra chanting, sankalpa, body awareness, breath awareness. Then you enter into warm-up asanas. There are only 3 to 4 main asanas that should be practiced. Then entering into certain relaxation, and then ending with yoga nidra. So asana class has to be designed. We will have a very lengthy, detailed topic on this in future though. But just to give you a gist of it, at any point in time, any prenatal yoga session should not be designed in a manner where it puts any kind of exertion to the body of the mother. So the experience and the end result of the prenatal yoga class has to be relaxed. If the entire schedule of the class is designed by keeping in mind only relaxation of the mothers, in most cases, it should turn out fine for all the mothers. Having a light snack around the mother, or mothers can have them carry with them, is very important. So, although most yoga practices discourage eating 2 hours before the practicing of yoga, but pregnant women should actually have a very light snack, such as like maybe a small fruit or something, an hour before the yoga starts, and should stop and drink water if they feel thirsty in the middle. Also, it is fine. If they are too hungry in the middle, that is also fine to have a slight, maybe half a banana or an apple or something like that. So it's really okay to listen to the body during this phase of the pregnancy. So there are certain practices that should be avoided in the first trimester itself, and beginning with pranayama practices. Certain pranayama practices like rapid breathing, and any kind of breath retention, like also known as kumbhaka, or rapid breathing pranayamas such as Kapalbhati or Bhastrika. All this should be avoided from the beginning of the pregnancy itself, because these type of practices can cause increased heart rate and can also be dangerous for mother and the baby during the pregnancy. The second one is risk of any kind of abdominal damage, wherein so any kind of kriyas or asanas that causes too much discomfort on the abdomen region, such as sit-ups or repetitive overuse of rectus abdominis muscles, or exercises that put too much pressure on the muscles of the abdomen, or deep twisting. All this can be really harmful for the baby, so just avoiding all that. Forward bending and standing or forward bending or seated poses with legs together. These types of poses can also put too much pressure on the abdomen and cause discomfort. So if you are doing forward bending poses for a longer period, then I recommend to use chair in front of the hands, or maybe walls. So some kind of support is required if forward bending is done for the purpose of stretching or maybe some Surya Namaskaras, etc. So support is helpful, especially in the later trimesters. Stomach lying poses. So although these types of poses can still feel okay to be practiced during the first trimester of pregnancy, because you don't feel the stomach at all, like you feel that it's just the same, but it should be avoided. All kind of asanas that require for the mother to be on their stomachs should be avoided from the first trimester itself. Now, bound poses. So most bound poses should be avoided in the second trimesters, as they put pressure on the joints and the abdominal muscles and can really cause discomfort and instability. But if required, it can also be avoided in the first trimesters if it starts to put pressure in the early stages of pregnancy itself. Lastly, it's important to listen to the body. So all mothers should be guided at all points in time to avoid any yoga poses that does not feel good. Their feelings should be paramount, kept in mind first and foremost. Prenatal yoga should be very enjoyable and comfortable experience. So let them know this practice. It's really not about being perfect yoga masters or being perfect at asanas, and this is not the right time to do that. Even though some mothers must have been regular yoga practitioners, must have been very good or flexible at certain asanas, this is not the time to test their limits, do the best stretching, or do the postures in the best manner. It should all be about relaxing, being comfortable, and enjoying the process. And at any point in time, if they experience discomfort and pain, they should stop. Let's hop on to the second trimester and the medical tests, changes in the body, precautions and yoga practices that we should take care during the second trimester. So second trimester is basically also often known as the golden period of the pregnancy, and the typical symptoms of the first trimester, such as fatigue, nausea, bloating, have often subsided during the second trimesters. And women can really enjoy a renewed sense of energy and well-being during this trimester. And this trimester is also characterized as the baby's rapid growth and development also occurs in the second trimester. So during this time, baby's skeleton begins to harden, and the organs and the muscles start to function properly. And the uterus continues to expand, and the baby's movement can start to be feel like mother can actually feel the moments of the baby in this trimester itself. So this trimester is basically a great opportunity for the mothers to continue to start their prenatal, continue or really start their prenatal yoga practice if their first trimester has been difficult. Second trimester can really be the time, if they haven't started, to stay active. This is the time that they can use the power of prenatal yoga to really help themselves. And prenatal yoga in this phase can really help them stay active and maintain good posture and balance, and prepare their bodies for the upcoming labor and delivery after the third trimester. So it's important that we understand all the changes and development that occurs in the second trimester to modify the routines and provide a safe environment for the mothers accordingly. So basically, coming on to the test. So the first test that happens during this phase is, of course, the ultrasound. Now, when the ultrasound happens during the second trimester, this can really help detect any abnormalities or disorders in the developing fetus. Sometimes due to some genetic disorders or some other medical conditions, it is possible that fetus or the baby is not developing properly. But all that can be noticed in the second trimesters itself, since we can really see the development of the baby happening in between. The ultrasound test basically uses high frequency sound waves to create images of the fetus. And although like the second trimester ultrasounds sometimes are less accurate in determining the due date of the coming baby, but it still is very useful in detecting the abnormalities that I shared before. The next test that happens is amniocentesis. This test is an optional one, and it involves the extraction of small amount of amniotic fluid using a needle. And this extracted fluid is tested for various, once again, the genetic disorders or chromosomal disorders. Also includes neural tube defects. So once again, this test can carry a risk of slight miscarriage. And as discussed with the CVS, in this test also, it's important to not do or refrain with any kind of physical activities for 72 hours. Next is blood test. So blood test is performed in this trimester in between 15 to 20 weeks of the pregnancy. Once again, the blood test that happens can help with noting the levels of glucose in the body and any other like levels of anemia if it's going high or up. So all this can be checked during the second trimester. The test that also includes in the blood test is checking the alpha-fetoprotein levels, estrol level, STG levels, and inhibin A level in the blood. And this test is basically to detect any potential health problems in the fetus and to check if any early interventions are required in order to keep the development rate of the baby at well pace. So all these tests are also done in the second trimesters. Now, in the second trimesters, the changes that occurs usually it includes like reduction of fatigue. The reduction of fatigue is very common occurrence in the second trimester. as the body has now adjusted with all the changes that brought onto the body by the beginning of the pregnancy. So many women actually find that they have more energy and feel less fatigue during this phase, and also reduction in nausea. So if some women has experienced a lot of vomiting or morning sickness during the first trimester, for many women this symptom also starts to go away, and as they continue to be in the second trimester or even in the third, mostly if the nausea has surpassed, then it doesn't come back even in the third trimester. Though the intensity and the amount of symptoms that a woman is experiencing from nausea or vomiting can really vary from woman to woman. For some week, the nauseousness can actually continue until mid of second trimester also. At times that is around 4th or 5th month also, but for most women it surpasses after the 3rd month itself. Another symptom which is often common is abdominal swelling. Abdominal swelling is caused by growing uterus, and which is putting a lot of pressure on the surrounding of the organs, and it can cause swelling. Next is changes in the skin, which occurs in the second trimester. That can include dark line from the navel to the pubic bone, and brown patches on the face, patches on the skin irritation or rashes, and sometimes rashes on the stomach area, and darkening of areolas, in between your thighs, and stretch marks can also begin to occur during this period itself. Another common symptom is ligament pain. The stretching of the uterus during the second trimester can cause ligament pain, which can be sharp and or lingering, and can occur after sitting for long periods of time and then standing up suddenly. So that's why frequent moments are quite suggestive during this trimester. Heartburn can also be present on and off during the second trimester, as uterus is putting too much pressure on the stomach, can cause acid reflux. Some women can also begin to feel baby movement during this stage, and which is also kind of often called as butterfly flutters or quickening. Braxton hits or contractions, which is kind of fake contractions, can also occur during the 5th months into the pregnancy, and are also often described as tightening or hardening of the uterus, or it can feel like menstrual cramps also. So to some women, it can occur as early as 5 months, but to most women it actually occurs, even if it has to, occurs during the late 3rd trimesters. The next symptom is extreme fatigue. On certain days, women can actually begin to experience extreme fatigue, which is also possibly due to the baby going through growth spurts and growing rapidly during few weeks within the second trimesters. And these physical and emotional changes during the second trimester can be managed with help of prenatal yoga. So all these physical and emotional changes during second trimester can actually be really managed well with prenatal yoga, and this can really help all the practices that we combine together, such as yoga nidra, pranayamas, asanas, and all the relaxation asanas, other relaxation practices, or meditation. All these can actually help mothers to manage the symptoms quite well during the second trimesters as well. Now, the precautions that we need to take care or have during the second trimesters. So all that we discussed during the first trimester remain as it is, and there are some new considerations to be made, the key points would be to, that allowing the mothers to know that their belly is growing, and so you also have all in mind that the belly has now grown as compared to the first trimesters. Sometimes we are not consciously aware of that, and that's why the side bends or slight twists that we were performing quite well in the first trimester may not be quite well in the second trimester anymore. So once again, avoiding any kind of deep twists or sudden shifts or even side bends which are done rapidly should all be avoided. So with very much utmost care, by keeping in mind that even the muscles and the skin layer of the abdomen regions have gone very thin. So considering all that, everything should be done being mindful of the belly and the abdomen region basically. And so if the woman has been inactive during her first trimesters due to common symptoms of like fatigue and sickness, so it's important that she starts her practice in the second trimester very slowly, because she has not adapted in the first trimester to stay active. Hence, she doesn't even know what are the differences that has occurred in her body now as compared to when she was not pregnant. So if she's starting the practice in the second trimester itself, it's really important that she starts quite slow and do certain testing, that how she feels after doing every few asanas, one or two asanas, or one or two activities, how her body actually feels after staying in a posture for, let's say, a few seconds and never overstretching those. So utmost care should be done for women, especially who are just starting the practice in their second trimester. So you can always allow the mothers to rest in the child pose as much as possible and as often as they need it. You can let them know that it's really okay to stop, not to rush over, and rest in child pose whenever they require during the entire yoga practice session. This also becomes the time when we need to stop doing asanas that requires us to lie down on our back for longer periods. So after 4 months of the pregnancy, lying down on the backs more than 30 seconds are not recommended. This is because of the constriction of the vena cava, which is a large blood vessels that runs from the legs and to the heart. The vena cava nerve, if it's compressed by the weight of the baby, it can cut off the oxygen of both the woman and the baby. So to avoid this, it's really important to let the mothers know to really even get up from their sides or use a yoga booster to support their back at any point in time if they require to lie down for some time. And in practices such as yoga nidra, etc., postures of lying down on one of the sides should only be recommended. Now, there are some postures and practices that should be avoided from second trimesters onwards, or should actually be avoided completely during the entire pregnancy phase. Beginning with upward facing dog, also cobra posture. This posture can actually put a lot of pressure on the uterus, and which can be really dangerous for the baby, and hence it should be really avoided. If it's to be done, it can be upward facing dog is anyway not recommended. If you're doing downward facing dog at any point in time, then there are certain precautions that can be taken, which is guided in the asana series. Wheel posture requires a lot of strength in the core or in the abdominal muscles, and it can put a lot of challenge on the womb as well as the abdominal muscles. So we have to avoid this at any point in time. During the entire pregnancy, it can be really harmful for the mother and the baby So wheel posture is completely no-no during this phase. Any unsupported back bends. Even if you're doing slight back bends, it can put a lot of stress on the lower back, which can be really uncomfortable for a lot of women since the back is changing its shape. Based on the growing baby, the curve is getting deeper and deeper, especially in the lower back. So when the curve in the lower back is getting deeper, there's a lot of stress that has been put on the lower back already in the process of pregnancy. So hence putting an extra pressure on the back can be really harmful for the baby and can damage the uterus. Headstands and hand or any kind of complete inversions are complete no-no. So because these poses can reduce blood flow to the baby, they are not recommended during pregnancy. Also, at the same time, these postures require balancing a lot. So since balancing is challenging during the pregnancy, so they should be avoided. Any kind of intense twist. All the twisting will put a lot of pressure on the uterus and abdominal muscles, but intense twists can be actually very dangerous for the fetus and the baby. So it's best to really avoid any kind of intense twist during the second trimester, especially because the belly has started to grow, and it's really important to take care of this fact that muscles are quite thin now at this stage. The next would be any kind of asanas that requires the mother to lie down on the back. So lying on the back can really reduce the blood flow to the baby and can be very uncomfortable to the mother. And it's best to avoid any backline postures in the second trimesters because of the fact that the vena cava nerve, which is the largest nerve in our back, can put the backline postures can put a lot of pressure on that, and it can reduce the blood flow to the baby. That is why it's important to avoid any kind of backline postures that require the mothers to stay on the back more than 30 seconds. And hence, transitions are okay, but if anything requires for the mother to lie down on her back more than 30 seconds, it should be avoided. Even if she's getting up, it's important to come from her right side up, which is explained during the asana series. The next would be any arm balances or intense postures, which are challenging or can put a lot of pressure on the abdominal muscles. They can also be very dangerous for the fetus, so it's best to avoid them during the second trimesters. Stomach lying postures are anyway not recommended during the entire pregnancy, so this is a big no-no even during the second trimesters. Now, forward bends with straight legs. If any time you need to practice forward bends, it should be done with legs slightly bent such that they are not putting too much pressure on the uterus and the fetus. So if required, you can avoid them, but if they are part of certain asana series such as Surya Namaskaras, etc., should be done with bent knees. Now let's move on to third trimester and see the tests required during the third trimester, bodily changes, precautions, and the changes in the yoga practices that occurs during the third trimester. So basically, the third trimester of the pregnancy is final stage for prenatal development, and it marks as the last 3 months of the pregnancy. And during this time, the baby undergoes rapid growth and development and preparing for its arrival to the world. And during this trimester, the mother may experience a lot of physical, emotional changes that she has to adjust to, especially the increased size and weight of the baby and her body as well. So this can lead to difficulty in sleeping, increased fatigue and discomfort from the growing belly. So it's important that the mother is maintaining a healthy and active lifestyle. If through prenatal yoga, that's a great option for her to really help herself with physical, coping up with the physical and emotional changes that are occurring in the body. This will also help her stay calm, being aware, and also a need to connect to her baby would also be fulfilled by the practice of prenatal yoga during this phase of her life. Now, to make the practice safe for the mothers and effective for the mothers during this phase, let's understand that what kind of major changes she's going to go through and what tests she goes through and what we need to take care. So first would be the certain tests that she goes through is Group B streps, also known as GBS test. It's a vaginal and a rectal swab test conducted at the 37 weeks of pregnancy to check the presence of Group B streptococcus. Basically, the test is usually positive in 25 to 30% of the women if done in the late pregnancy, as the bacteria can come and go without symptoms. And I have personally known women who have lost their babies due to this bacterial infection. So this test is basically done to check any bacterial infection that begins at the vagina to detect. Also, in a good practice of, let's say, the maternal care practice, most doctors recommend to do urine tests quite often so that the detection of bacterial infection, urinary bacterial infection, is quite early, and they don't have to lose any kind of babies at a later stage. So basically, in case the test is positive here, the antibiotics are administered during the labor to prevent transmission to the baby and any potential health issues. The test is actually valid for 5 weeks and can be repeated whenever necessary. The next very often thing that happens is quite number of increased frequency of urination. The women actually, since the baby's shifting position and compressing her bladder constantly, this often leads to multiple nighttime trips to the bathroom, and some days mothers may experience extreme fatigue due to growth spurts and sleep disruption caused by often waking up because of urination, and also the compression of the stomach can also limit the amount of food that she can eat at one time, so she can feel hungry quite often. So all this can actually lead to fatigue. Now, heartburn is also very common during the third trimesters, and also Braxton Hicks, which is kind of slightly fake contractions, is also very common during the third trimesters. The navel may also pop out in some cases, and the limited room for the lungs to expand can cause shortness of breath. The breast continues to swell, sometimes leaking colostrum, which is the golden milk, the beginning of the milk coming out of the breast, and that's very nutritious for the baby. Some women actually save it. And the ligaments of the women can also stretch and tighten at this point in time. So late in the pregnancy, there may be pressure on the bottom of the pelvis and can cause edema, which is swelling of feet, hands, ankles, and wrists, etc. can occur during this stage. Coming on to the precautions that we need to take care in the third trimester. First and foremost would be all the precautions that we had in first and second trimesters continue to remain as precautions in the third trimesters as well. This also includes like avoiding poses that involves lying down on the back or for extended period of times, and poses that can put pressure on the belly. But one of the biggest differences in the third trimester is the amount of energy and stamina that the mother may have. So it's really important to give the mothers permission to do only part of class and rest in child pose or maybe in yoga nidra if they want to, or they can often go into child pose in rest in between different asanas also. That is possible. So as the mother may notice more of a difference in now, like what feels good to her and what doesn't feel good to her, and in fact it can change as often as like on weekly basis. So last week if she was feeling comfortable in certain asanas or certain practice, but now she may not feel comfortable at all. So we need to be really flexible here to allow the mother complete freedom to choose what she wishes to practice out of a yoga class or what she does not. Especially if she wants to take long breaks in between the asanas, it should be absolutely fine. So our classes are really required to be designed either individually as per the mother's requirement, or if it's a group class, then there has the need of each mother in each phase of pregnancies are required to be taken care. Now, another factor to keep in mind is increasing movement of the baby. So by 36 feet, the baby should be head down. That means the head should be towards the opening of the vagina. But for some women, the kicking may feel near the top of the uterus or around the chest area, which is typically means that the baby is either the head down if the baby is head down, then the kicking is of course will be upwards. But if the baby is head up, which is the reverse position, then the kicking will feel in the down side of the abdomen. So it's really important, since the baby is trying to prepare itself to come into the delivery position, which is the head down, and might rotate a few times during the last trimesters. So it's important for the women to really listen to their body and not push themselves too hard, because the baby is already trying to move slowly and slightly into the right position. So a lot of baby movement can disrupt the easy flow of certain practices during the yoga session. Now, there are certain poses that we should completely discontinue, such as downward facing dog, or if the baby's head is down and the woman has large amount of fluid or heartburn or high blood pressure, or if the baby has recently moved to the head down position to the breech baby, in that case it's important that we avoid downward facing dog in all these situations. With the forward bends, women can, at this stage can also have condition which prohibits her inversions, such as like certain eye conditions also, such as glaucoma. So she can really feel dizzy suddenly. So in this case, it's important that she is really practicing with cautious while being totally aware of how she's feeling, especially when she's doing forward bends and going downwards, and how does she feel, whether her vision is clear, she can balance well or not. So all this keeping in mind. And if she has to do forward bending, then legs should be separated enough for the belly to fit comfortably, and women may need to bend her knees slightly when practicing forward bending at any point in time. breech baby. Women with breech babies should actually discontinue bound ankle poses or wide leg postures after 34 or 36 weeks to avoid any kind of potential risk to the baby. And it's important that she listens to her body and discontinue any pose that doesn't feel good anymore at this point in time. So pregnancy is really a unique time in a woman's life, and each woman will have different needs and limitations. So as teachers, it's really important for us to understand their needs, modify or offer alternative postures at all point in time. And at the same point in time, do not lose focus of the fact that prenatal yoga, even though it requires some precautions, but it is a great help for mothers to stay active and also provide healthy emotional and mental balance. So we need to use the best parts of yoga and yogic lifestyle to offer to women in all the trimesters and really offer the best of the practices to the mothers at this stage. So next is premipara and multipara, the differences in the pregnancy. So premipara is the woman who is first-time mother, and multipara is the mother who has given birth already 2 times or more times. So the differences in the experiences of the mothers, being a first-time mother or second or third-time mother, are quite different. Sometimes the bodily changes or symptoms can also be very different. So the baby moments can feel more in the ligaments, like the sensation in the ligaments is quite often in the case of first-time mother, and in case of mother who has already given birth, she can experience more of pelvic pressure and stretching sensations, basically. So by understanding these differences, you can really offer tailor-made support whenever required, and advice also to the mother if they ask you in regards to different postures and practices. So it's important that you know if they are being the first-time mother or this is their second pregnancy or third pregnancy. So basically, more beyond the perimpara or a multipara pregnancy, there is also another distinction, which is twins or multiple twins. So women can be pregnant with one or more than one child at the same time, and in this case the changes are slightly different once again. Of course, the bellies are quite larger than those of the single pregnancy, and this can also require different modification in the yoga practice. Also, modifications may require to start earlier. For example, modifications in a normal case which might require to be there in the second trimester might require to be done in the first trimester itself for a woman who is pregnant with the twins. And also with the rise of IVF and other fertility treatment, the rate of multiple pregnancies is quite increased. So as teachers, it's really important that you understand that there are a lot of women that are going to come to you with multiple pregnancies. So you'll be prepared and understanding the important body changes for the mother with twins is also important. There is no major differences that occurs in the conditions and the symptoms of the body when the mother is pregnant with the twins. It's just the belly is more heavier in size, the size of the stomach rises more rapidly as compared to a single pregnancy. So all the modifications and precautions that are required to be taken in second or third trimester might require to be taken quite earlier in their cases. It's also very well quite possible that women pregnant with multiple twins may not be able to perform asanas at all in their third trimesters because of the heavy size of the belly. But they can still use the benefits of yoga nidra, visualization, meditation, sankalpa, or breathing, because the more the pressure on the belly, the abdominal muscles and the other organs, the difficult it will get for her to breathe, to move. So asanas such as Janu Sanchalan, where it's like you're giving slight movement to the wrist and the ankles and the foot, all those slight moments of wrist rotations and asanas that can be done, performed while sitting, all those can be beneficial to the mother with twins. Also, yoga nidra practice, visualization practice, and continuous practice of pranayama will be really supportive in her pregnancy journey and also at the time of delivery. And with that, really thank you for listening throughout these changes, and I really hope this helps you in your journey of being a great teacher for the mothers. Thank you.